Welcome to the Euvie Podcast. In this episode, we will be discussing the vagina. First and foremost, contrary to popular belief, the vagina is the muscular tube located inside the body. It cannot be seen from the outside, and the term vagina does not refer to the external organs of the reproductive system. The external genitalia of the female reproductive system is collectively referred to as the vulva. These are the organs that can be seen externally. The vagina is a muscular tube that connects the internal organs of the reproductive system to the vulva. The vagina is about 3 to 5 inches long, from the vaginal opening to the cervix. It is a common misconception that the vagina is a continuously open space, but this is false. Think of the vagina as an unfilled balloon. It has the capacity to expand, elongate, and conform to anything that is placed into it, be it a finger, a penis, or a tampon. However, please do not put any foreign object in your vagina. Speaking of foreign objects, it is a misconception that douching is good for the vagina. This is completely false, as douching is absolutely terrible for the vagina and for vaginal health. Although some women say that douching makes them feel cleaner, there is very little scientific evidence to prove it. Some women attribute their reason for douching to prevent vaginal odor, remove excess menstrual blood, prevent pregnancy, or to prevent sexually transmitted diseases and/or infections. However, health experts say that douching actually increases the risk of pregnancy complications, sexually transmitted diseases, and a variety of other health problems. Douching upsets the natural bacterial balance and pH in the vagina, which is slightly acidic, at 4.5. This creates a more favorable environment for infectious bacteria to grow and can cause vaginal infections such as bacterial vaginosis. Bacterial vaginosis may cause infertility, increase the risk of both preterm labor and endometriosis. Douching can also increase the risk of pelvic inflammatory disease, or PID. According to WebMD, women who douche may have a 73% higher risk of getting pelvic inflammatory disease. Douching has also been proven to increase the likelihood of an ectopic pregnancy by up to 76%. The more a woman douches, the higher the risk. You should most definitely not douche. Vaginal odor is normal, and you should not be embarrassed by it. However, a pungent or excessive amount of vaginal odor could be a sign of infection. Please talk to your doctor. To keep your vagina clean, you really do not have to do much. The vagina will naturally balance its own bacterial environment, and simply washing the vulva with water is sufficient. Another common misconception of the vagina is that of the hymen. Contrary to popular belief, the hymen does not fully cover the vaginal opening, and it does not always pop when a woman has sexual intercourse for the first time. Although every woman has a different hymen, the hymen very rarely covers the entire vaginal opening. Rather, the hymen is a thin membrane that only partially covers the vaginal opening. Some hymens cover less, and some cover more, but it is very rare for a hymen to cover the entire vaginal opening. This must be handled by a medical professional. Because the hymen partially covers the vaginal opening, there is a chance of it tearing when a foreign object is inserted too aggressively into the vagina. However, like any part of the body, the hymen will heal. One more common misconception about the vagina is that the vagina is the way through which urine exits the body. This is false. Urine does not exit the body through the vagina. Urine exits the body through the urethra, which is attached to the bladder. The urethral opening is located just above the vaginal opening in the vulva. This is what makes it possible to urinate with a foreign object in the vagina, such as a tampon. The vagina serves many functions within the female reproductive system. For example, the vagina is the pathway that a baby uses to exit the womb during childbirth. For this reason, the vagina is sometimes referred to as the birth canal. The vagina is also the way that menstrual blood exits the body. The vaginal environment, along with the cervix, helps to prevent pathogens and harmful bacteria from entering the uterus. The vagina is also the area where the penis deposits sperm during ejaculation, but fertilization usually occurs in the fallopian tubes, and the zygote implants itself in the uterus. Moving on to the histology of the vagina. The vaginal wall consists of 3 layers called the mucosa, the muscularis, and the adventitia. The mucosa, which is the innermost layer, is a squamous, stratified layer that contains glycogen. This glycogen is used by the good bacteria in the vagina. As the name suggests, the muscularis of the vagina contains the muscular layers of the vagina. In fact, it is composed of 2 layers of muscle, the inner circular layer and the thicker outer longitudinal layer. The outermost layer of the vagina is the adventitia. Rich in elastic fibers, this layer is mostly composed of fibroelastic connective tissue and connects the vagina to the surrounding structures. Now we will take a 1-minute break before moving on to some of the diseases of the vagina. Vaginitis. Vaginitis is a very common disease of the vagina. It is usually caused by a yeast infection or by the overgrowth of bacteria. Symptoms of vaginitis include excessive vaginal discharge, itching, and a change in odor. Antibiotics and antifungal medication are used to treat this disease. Bacterial vaginosis. As previously mentioned, bacterial vaginosis is often caused by douching. However, it can also be caused by having intercourse with a new partner. Symptoms of this disease are excessive or abnormal discharge and a change in vaginal odor. It is treated with antibiotics. Vaginismus. Vaginismus is a disease that causes involuntary spasms of the vagina during intercourse, making penetration difficult and painful. It can be caused by emotional distress about sex or by other medical conditions. The treatment for this disease often includes psychological counseling, medications, or both. In addition to these diseases, the vagina is susceptible to a variety of sexually transmitted diseases such as gonorrhea, HPV, chlamydia, and trichomoniasis, among a myriad of others. Please remember to be safe during sexual intercourse, and remember to talk to your doctor if you notice anything abnormal at all, as the key to treating many diseases is early detection. That's all for this episode of Euvie. Thanks for tuning in.